So again, greetings everyone. Thank you for joining us. And today's training is aligning age-friendly communities and public health to promote equitable, healthy aging. So just some, as we call it, housekeeping to get you all started. Please make sure you're on mute during the session. We will invite you to come off mute during our Q&A session to engage with our wonderful speaker today. But for the primary part of the presentation, we ask you to stay on mute. If you have questions during the presentation, please put them in the chat. We will be monitoring the chat for questions. If they're for our speaker, if they're for us, we will definitely respond to you. So please use the chat as best you can, or as much as you would like, I should say. But you can again also save your questions for the end to ask our speaker directly. And also I want to just note that we do have closed captioning available for this session. So that is a function you can enable via Zoom. So those of you that are new to us, welcome. Trust for America's Health is a nonprofit, a bipartisan nonprofit. We're based in DC, and we are focused on policy, research, and advocacy, and that is dedicated to promoting optimal health and well-being for every individual in the community. Our AFPHS training series is part of an initiative that is heavily focused on and deeply committed to making public health a core function, healthy aging core function at public health and public health departments of health and across the country. This year, our trainings have focused on social determinants of health and how they relate to various topics. So we started with an overview of how social determinants of health relate to healthy aging. And again, our topics have been related to those since then. All of our topics are available to be viewed online if you're interested in any of our previous trainings. And then I also want to highlight a few little things more about TIFA. We have several reports that TIFA focuses on. We are deeply committed to not only health equity, but making sure that the health of everybody in the community is addressed and making disease prevention a national priority. So just an overview of livable communities. I often ask myself this question, like, what do I consider to be a livable community? For me, and please do not laugh, but I consider, to have a Trader Joe's, a park, and near entertainment, near a movie theater, near some kind of social outlet. But that's livable. It needs to be walkable. So again, can I walk places and things like that? But again, what is livable community? And again, it's one that we define as safe, but also has its choices and is secure. It allows independence, allows residents to remain in their homes as they age, and provides opportunity for engagement activities. So again, my Trader Joe's is valid. My Trader Joe's requirement is valid. Again, the key crux of livable communities is that there are essential features that allow residents of all ages and backgrounds to live and thrive in these communities. I don't want to take too much away from our speaker because she's going to provide all this wonderful context for us. And without further delay, I'm overly thrilled to introduce Dr. Kathy Black from the University of South Florida, my wonderful alma mater. No bias there. She is a professor at the School of Aging Studies in the College of Behavioral and Community Sciences. She's also an affiliate professor in the College of Public Health, where I received both of my degrees. So it's an honor and a privilege to introduce this wonderful speaker this afternoon. And I will be turning the mic over to her. So Kathy, the floor is yours.
Karan, thank you so much. Let me just minimize these the screen there. Thank you so much for having me talk about this topic and really introducing Livable. And I think it's a very good point that Livable is really, it's very subjective in what it means to people. And I'm honored to be part of this training series, which focuses on how livable communities are addressing the social determinants of health. So let me just say to people who are here today, thank you for joining and being part of this. I am honored to present to you today, and I have been involved in the age-friendly work at the local, state, national, and international level. So I'm really, glad to share all of that with all of you. And most recently, my colleague, Dr. Marissa Levine and Brittany Veal We just completed a public health toolkit report on equitable healthy aging, as you see there, and a guide for community health improvement. And that is publicly available and free. And I am sure that we will follow up by giving you the link to access that. Next slide, Karan. So there are a lot of terms going around, and terms and oh, I'm seeing some names pop up on the screen. Nice to see everybody here today. So it's really important to define some of these core terms. There is overlap among many of them. And I'd like to frame social determinants in the context of equitable, healthy aging and age-friendly communities. And I'd really, for those of you who don't know me, you should know that I'm all about making a difference and how this can really help you in your work and your practice. And I hope to inspire you as well. Next, please. So as Karan said, a livable community is safe and secure, offers choices to get around, equitably serves people of all ages, abilities, incomes, race, ethnicities, and other backgrounds. And this is a definition from the AARP. AARP does widely use the term livable communities. They have division. They have been involved in really livable communities since the 1964 World's Fair, actually. And you often hear the term livable communities used by urban planners. So it is widely used. Having safe, healthy, and livable communities where older adults can remain active and engaged is part of healthy aging. So there is a great, tie-in with age-friendly. Again, it's often used interchangeably. Next slide, Karan. But as you can see, definitions for age-friendly communities can vary slightly. There is no one definition. Here's an AARP definition for age-friendly community: supportive physical and social environments, enabling people to live active, safe, meaningful lives. There's a earlier WHO definition: encouraging active aging by optimizing opportunities for health to enhance quality of life. And we shared for you Age-Friendly Sarasota's definition: promoting active, healthy, engaged living for people at all life stages and abilities throughout the life course. Many age-friendly communities, first of all the age-friendly communities can define age-friendly as they like. And many of them will also often include a tagline. It is one of the, we're going to talk about age-friendly communities in a minute, but there is no one standard definition, and so there's a range. So I just wanted to get all that out there. Next, please, Karan. And I think, as everybody knows, it's about a changing perception of aging. It's not just a negative paradigm on aging, but it's really an increasingly positive view. The WHO, strongly asserts that aging is a human right, and people have the right to meet basic needs, learn, grow, be mobile, contribute, build and maintain relationships. Again, at all stages of abilities. And along the right column there, healthy aging has been defined variously in the United States. This is one of the more recent definitions with the Public Health Accreditation Board, and TIFA was involved. It's a work in progress. The process of maintaining and promoting physical, mental, that's cognitive and emotional, spiritual, meaningful social engagement and social well-being and function as people age. And I suspect there will be continued evolution to the definition as well. Next, please. So building upon the definition of health and health equity, my colleagues and I have extended the Robert Wood Johnson definition, meaning that everyone has a fair and just opportunity to optimize health and well-being at all life stages and abilities across the life course. And it is achieved when every person has the opportunity to attain their full health potential to age well, and no one is disadvantaged because of social position or other socially determined circumstance. Next. Here's a slide from the WHO, because when you dissect every person has the opportunity to attain their full health potential, the WHO reminds us that health in older age is not random. For those of you who've been around for a while, it used to be that longevity was, predicted by your parents' or grandparents' age. And there was a huge period where it was heavily focused on genetics or lifestyle factors. And today it is increasingly seen as interactions between the broader characteristics of people and the environments in which they inhabit. And I don't need to tell this group about what's in a zip code. Where you live matters. It's associated with life expectancy, including difference of decades just a few blocks away. So we'll talk more about that in just a moment. Next, please. So when we look at equitable, healthy aging, health in older age reflects a lifetime of cumulative advantage and disadvantage, underscoring the imperative to address both the current cohort of older adults. But again, we've got to keep on thinking about who's, coming into those older ages. And so if we don't keep people healthy as far as prevention, we are really, missing the mark on it. And public health is really in a very good position because, of course, it works with people of all ages. And so it's about promoting healthy aging across the life course, as well as meeting the unique needs of older adults. Equitable healthy aging is inextricably linked with the little image that you've got there with the various terms, life course and social determinants and intersectionality. So it's very important to influence the trajectory of healthy aging at every life stage, and not just wait till you're 65 to make a difference. And just again, reminding everybody that people face constrained choices and blocked opportunities across the life course. I think the next, the next couple of slides will speak more to that. Karan, next slide, please. I don't know if Aaron Guest is on our call today. Because I loved Aaron spoke about social determinants a while ago, and he had up a great visual too. And our team created this little visual because when we thought of upstream and downstream, we were thinking more of a stream. I'm from the Northeast and I love streams. And so that was the visual that came to our mind. And of course, everybody's familiar with all the downstream disparities. But here we're really creating a visual for you that the social determinants really are midstream. And, of course, the upstream causes are of health inequities are really where we want to continue to drive some of that change. So the social determinants are very, very important. Everything that we can do to improve equitable healthy aging is very important. I'm one of these firm believers that, I'll take anything. But obviously we do need to be concerned about, prevention. And so the further upstream we get, the better off we are. Next slide, Karan. And I love this particular image from the Kaiser Family Foundation, because I think it does a very simple job of showing each one of those social determinants and really the inequities across the life course that really do lead to those disparities that we see later. And economic stability influenced by employment and income and expenses and debt and medical bills. In the area of neighborhood, housing, transportation, parks, playgrounds, and you all have seen all the work, the mounting work in all of these areas. And as you can see here, again, through education and food and community safety and the healthcare system itself, all of these factors are those very pieces that we experience day in and day out. And again, influenced by a million other factors. And that's really where we'd like to focus some of our efforts. Next. So achieving equitable healthy aging requires recognizing the unique and cumulative factors that shape health and well-being across that into later life, and actions to advance accessible, inclusive, empirically informed, and culturally relevant PSE, folks, policy, systems, and environments that really are going to make a big difference in healthy aging. And dismantling the systemic and structural barriers that result in those inequities that are exacerbated by later ages. Next slide. There's a hodgepodge. Yes, thanks, Megan, for sharing that, because I attend most of the sessions, and I do remember I love all that TIFA is doing on this special series, and all that they do anyway. I'm big fans of theirs, they know. But we have a hodgepodge in this nation of of healthy aging and the positive paradigm on aging, and on equitable healthy aging. And one of the one of the nation's leading models is the National Prevention Strategy, which is a joint effort between the Office of the Surgeon General, the CDC, and the Department of Health and Human Services. And they identify 4 strategic directions as a foundation for a prevention-oriented society. And you can see I've highlighted here healthy and safe community environments. So what things will make a difference? Increasing the supply of accessible, affordable, adaptable housing, creating more walkable communities, improving older driver safety, enhancing transportation options, access to healthy food, developing plans to vulnerability and natural disasters, protection from elder mistreatment. And I know that you've had excellent presentations on literally all of these. And again, focus on the workforce, because people do need to be trained to better deliver services in all of these areas. Next slide. At the international level, the WHO public health framework for healthy aging is really, guiding principle for all of us. Basically recognizing that the goal is really to keep people as high level of functioning as possible. So as we experience normative and pathological changes with aging, they can happen at any age. But the goal is always, primary intervention, just keeping people as healthy and as possible. So keeping that capacity up. And again, secondary intervention if people experience some issues, intervening quickly so that we can, keep the level of capacity going. And as people inevitably face, changes and decreasing capacities at the end of life, 9 out of 10 of us will experience a declining healthcare course, which includes decreases in our functional abilities. Only about 10% of us die suddenly. So the majority of us will experience decline in capacity, but WHO asserts, why not keep people as high functioning as possible for as long as possible? And they integrate that with health services and long-term care. But as you can see here, they also call out the role of environments in promoting capacity enhancing behaviors, and also in removing behaviors that impact people's capacity as they age. Next slide. In their global strategy and action plan on aging and health. Oh, Karan, can you, does that not show what the, oh, there we go, it comes in. You might have to click a few more times to get those in. They have 4 priority areas, and we're pointing out, we're missing part of that, but there we go. And here, just calling out to you again, at the international level, calling out that age-friendly environment. Again, recognizing that the environments in which we live matter to equitable, healthy aging. Next slide, Karan. And so to support age-friendly environments, starting in 2006, the WHO embarked on a multi-year effort that involved more than 20 countries and thousands of professionals and caregivers and older adults themselves, and really identified what features of environments matter. They launched a global network in 2010. That network is constantly growing, and well over 1,200 communities in over 40 countries. And this is, at any point in time, this is outdated information, my friends. But the point is, this is a global movement to improve the environments where we live. And next slide, Karan. In 2012, AARP became a national affiliate to the WHO. The WHO is, has 196 or so member countries. And so the United States is one country, folks. A conduit through our country to have, an easier path into the WHO is great. So many people, many of the communities join the AARP network of age-friendly communities and states, and they are automatically uploaded to the WHO age-friendly community network as well. So they're part of this, of the statewide, the national and the global network. And this too keeps on changing. Right now there are 9 states and 1 territory. And as you can see, almost 700 age-friendly communities in the United States. Next slide. Oh, if you click, Corinne, there you go. So in order to become an age-friendly community, it can't just be an individual or an organization. It has to be the highest level of government joining. So for example, a governor, or at a county level, a board of county commissioners, the chair, or a mayor, if you're talking about a local city or a municipality. So that's those are the members who are eligible to join. And then you embark into a 5-year process that actively involves older adults throughout. Nothing about us without us. Okay, it's not what we're going to do for people. People are involved in co-creating and providing input on what can be done. And basically each entity that joins embarks upon some sort of assessment. It's usually a combination of qualitative and quantitative information about what that community or area wants to do to make their environment more age-friendly for people as they age. They usually around the 2nd year, they complete an action plan, which basically sets forth goals and metrics about what they'd like to accomplish. At the end of the 5 years, which is 3 years of implementation, how do we do on what we said we were going to do? And then the cycle continues. I think it's fair to note that there's not too many things we can do in just a year or two. You all know, short-term outcomes or moderate term, 3 to 5 years, really making change in society takes a long time. And some of these changes, particularly to infrastructure, can take very long time. So for example, the country of Ireland is all age friendly. They're into their 15th year now. And by the way, they didn't take any money. There was no funding to become age friendly. They looked at people's work, job descriptions, and they incorporated for the sustainability of better serving their aging residents. Next slide, please. And so that's the process. And what do we do with age friendly? Well, we're looking at what they call 8 domains of livability or community features. I like to group the community features. A lot of people, for those of you who have a little psych background, 8 things are kind of hard to remember. Sometimes 3 things are easier. So the built social and service environment sort of is more tidy to cluster those domains. And again, communities are looking at how those factors affect people's aging and what they'd like to see improved in those areas. Next slide. The WHO further, it's great to get involved in age friendly and to do things, but it really is about demonstrating and making a difference and making a change and really being able to measure that change. And if you don't measure it, you can't indicate that it's improved or gotten better. And so, of course, it's important to look at equity measures throughout, as well as increasing accessibility and inclusivity in the built and social environment. Next slide. So the built environment, why this matters for healthy aging. in housing, affordable and accessible housing and supportive services help people manage their daily activities and enable people to live fully and age in place, which is what they want to do. Oh, study after study. And there's a lot of information that is associated with greater life satisfaction and self-esteem. In the area of outdoor spaces, safe and accessible facilities and features for buildings and spaces, allow people to participate more fully in community life outside of the home. Again, multiple studies that is associated with improved physical, mental, and social well-being, in transportation, mobility options that offer reliable and affordable transportation, enhance accessibility to needed services and desired activities, as well as promote activities among older adults. Next slide, Karan. And here I just created a couple of collages for, in all of the domains, I've created some collages for all of you. Again, I'm mentioning, if we're really about doing what people want as they age and what they tell us they want, well, again, they're telling us over and over, they want to remain in the communities where they reside. And I'm not here to say there's not a need for 24-hour long-term care. There is, it's very important. But people want to stay in their homes as long as they can. And in order to do that, those homes need to be accessible. I've seen less than 1% of the nation's homes are universally designed. So people want to live there, but their homes aren't going to work for them as they age. And a lot of simple things can be done there. People also, don't want to, they need to be able to manage in their home. And again, that's instrumental needs, housekeeping and et cetera. These are things not covered by Medicare. So people will tell you that this is what they want and options. And, we're still building homes for, the traditional nuclear family, which folks hasn't existed for some time. It's just 1/5 of how we live today, but it is still a predominant model. So we've got a lot of work to do. Next slide. Transportation, as you all know, is really about access. And we really need to offer a range of options for people for mobility. We outlive our safe driving abilities by 7 to 10 years. What happens to people when they're no longer able to drive? And so, it's not just, and we, very auto-dependent world, as you all know. And so how do we create safe mobility options? There's a lot of work being done in this area, and we need to do more. And, honestly, this one always surprises me because, older adult driver and pedestrian injury and fatality are, public health measures as well. So there's a great intersection here, and it's very important to keep people, active with cycling and walking outside of the home. Next slide. And speaking outside of the home, we know a lot about how the outdoors, which COVID laid bare for us, how important it is for us to be in the outdoors and the health benefits. And so obviously everything we can do to make our environments, our outdoor spaces, and our own amount of work is looking at, for example, parks and our parks meeting the needs of older adults. They're great for somebody who wants to play soccer, but are they meeting the needs? And so there's a lot of opportunities here as well. Next slide. And why the social environment matters to people. Civic participation and employment options for lifelong training, paid work, and volunteering so that people can more fully participate in social, civic, and economic life. Respect and social inclusion. This is about being treated with respect. It is associated with enhanced dignity and well-being. You're all familiar with the ageism work and people who have ageist beliefs live 7.5 years less. And so it's very important that we don't reinforce that in anything and that we really alter that or counter that. social participation, affordable, accessible opportunities to counter isolation and contribute to social, mental, and physical and spiritual well-being. And I know it was just on one of the other slides, and I know that this group is very well aware of the impact of social isolation on morbidity and mortality. Again, considered a risk factor for mortality equivalent to smoking 15 cigarettes a day. Next slide, come on. And so here, for civic participation employment, age-friendly Tel Aviv, the doctors are giving out prescriptions along with telling you which medication to take. They're giving out prescriptions for volunteering and then giving you a list of all the health benefits. So when people hit the traditional retirement ages and they may have more time and choose to volunteer more and get involved in civic life more, the average retiree spending 49 hours a week watching television. The more we can do to encourage people to volunteer, look at how good it is for them. That's all good. And increasingly, folks today, people will need to work. They are financially unprepared for their longevity. And how do we make those workforces really meet the needs of people who have their own health issues, caregiving issues, et cetera? And so again, in your locales, these issues may be very prominent, and you are, again, impacting, and they're heavily intertwined with the social determinants, as you all know. Next slide. Respect and social inclusion. Some people, there was a very important article written some time ago from a Canadian researcher on age-friendly, really saying that respect and social inclusion is really more of an all-encompassing sort of feature rather than a community feature per se. And it really is. But we group it here because it fits more in the social realm. And, here we're talking about really addressing ageism. And again, that pervasive negative stereotypes, prejudices, and discrimination that is, pervasive in the Western world. It's about an age integrated society. It's about inclusion. It's about intergenerational. And it's about, all sectors and industries finding a place in, in promoting an age-friendly world that's good for people as they age. Next slide. And social participation, it's important for us to have a range of activities available for people, again, at all ages and abilities across the life course. Just because you have Parkinson, you can no longer go to your painting class. So obviously, the more that we look at, price points and opportunities in our community, the more we're keeping our community healthy. Next slide. The service environment is probably one that you're almost familiar with. And we group communication information here because a lot of it is about information about community activities and needed or desired services. And you all are very familiar with, the importance of, again, the digital divide. COVID has certainly laid that bare for us as well. But when you're talking about aging, it's more than just Wi-Fi access and, tech savviness. There's many more elements. And we do need to be very concerned about providing things in a variety of formats that meet people of all ages and abilities, and that includes things like font sizes and delivery methods and outreach activities. This is intertwined with health literacy and helping people navigate the continuum of care and self-efficacy in a very, very busy world. And so that's very important, and not just in the health realm, but obviously in all realms. I mean, just going to a restaurant, having access to information is important to live fully. In the area of community supports and health services, this is really about meeting people's needs really across the course, from prevention to emergency and end of life, to home care, to assisted living, throughout long-term care, supporting caregivers, and really just a comprehensive, integrative options that meet not just needs but also preferences. And so that's really a part of age-friendly. Next slide. And again, we're seeing a lot of real, wonderful things happening across the world, really. But libraries and museums getting involved, and all the sorts of players that can make a difference. And so, and to what extent can your work tie in? You're a chief health strategist, and you are. We're going to mention the 6 C's coming up in just a moment, but you're simply the maestro for all of these groups doing the work that's really enhancing livability and age friendliness for everybody. Next slide, Karan. And community and supports, again, most of you are very familiar with these, but these need to be, all of these services can better meet the needs of older adults. Again, not just as far as sensory issues with vision and hearing, but also in terms of language and cultural competency, and in all ways possible. So, you all, again, are most familiar with those areas. Next slide. And so the really interesting thing is that the age-friendly 5-year process and the community health improvement process is also 5 years. And most of you utilize MAP, not everybody. But in the MAP process, you've got an assessment in the first year or so, and then you've got a community health improvement plan that you're updating. Well, that is very similar to the age-friendly community process that is very aligned. And by the way, they're both focused on community features and health and well-being. So there is tremendous synergy and intersection in these processes. And by the way, there will also be synergy with MAP 2.0, which will put less pressure on the ongoing assessment. Will be more real-time ongoing, so that improvement plans are updated and added to, rather than sort of a blank state starting over. But that will also benefit the age-friendly work as well. So the point is that there's a lot of synergy and intersection there. Next slide. And so as you think about the pathways and trajectories that tie the root causes that lead to those later life disparities, and recognize the interactions in the environment across the life course, and to understand the accumulated inequalities that occur, and you're recognizing your own views on aging and countering ageism in all, within yourself, in your conversations with others, at your organizational levels with other community partners, and also at the systemic level in more macro policies and programs, and recognizing health as a human right, and always protecting those most vulnerable, but also recognizing the utilitarianism of and the greater reach of prevention, really hitting all people rather than a subset of those that were in the greatest need. Next slide, Carolyn. And I can't think of a better way to do that than through the age-friendly public health system 6 C's, because the public health professionals are going to want a model. And the age-friendly work has provided several models, and for public health professionals, the age-friendly public health system is greatly providing a model that's certainly being tested, not just in Florida, but far beyond. And so let's just share how those 6 C's will work. So in connecting and convening, those multi-stakeholders will help address the range of needs that are going to support healthy aging. Yet we know that it's a very fragmented system. So public health will be sure to include a preventive and community-wide approach that will help, and again, do the connecting and convening. And in terms of coordinating services supports, again, there's duplication and a lot of unnecessary duplication out there. And we know that people are going to need to navigate the continuum of care. So again, public health will help assure programmatic inclusion, addressing barriers, effective community offerings, again, promoting preventive health services for all persons, keeping people healthy across the life course. We know that, in utero, actually even parental health before pregnancy will matter in later life health. Collecting data, many of you are in that space, and synthesizing that information will be very important. And public health is a real leader in helping look at those risk factors across the community and targeting efforts. And I know that your last session was on data, and there's so many great data sources and great models that are already out there. And I love all of this work. It's just fantastic to support you. Communication is such an important part, communicating public health information to promote and support older adult well-being, and disseminating that to promote healthy aging. And again, public health leadership and promoting those healthy behaviors for people of all ages, which is informing people of all of these things. And again, people don't know what they don't know. And, for example, keeping people healthy in the home, keeping people safer driving longer, keeping people working in the workforce safer longer, all of these things, and public health's role in really helping promote all of that, and complementing programs, aligning community health with the broader system, again, across the scope from prevention to primary, secondary, tertiary, and emergency, and again, addressing older adults specifically, as well, again, recognizing that life course perspective. And then that 6C, which I'm so glad to see that in the area of policy, systems, and environments, which is where you're going to really get some, embedding and sustainability of the work, and also moving upstream more to hit some of those root causes. So again, I can't think of a better role for chief health strategist. And finally, Karan, we'll move to the next slides there very briefly. Here, this is very early on with the age-friendly public health action network in Florida, and look at all the work that naturally arose, very much focused on the social determinants and specialized health needs. And many of your own communities, wherever you are also, and again, this is about local. What are the pressing issues and who are the leaders? Where's the real movement happening in your community? That's where you're going to go with your CHAs and CHIPs. And so next slide, final slide, Karan. And looking at, again, this is from that initial age-friendly public health action network in Florida, but look at all the great work already being done, explicitly reviewing and including older adults in the emergency preparedness, and going back to the CHA. I had several conversations with someone from one of our counties today in Florida about inclusion in the CHA, and certainly we've got communities already, their CHIPs are very focused on healthy aging, and the policies and programs, and including the older adult voices and strengthening those relationships. Just all the great work that's being done that is moving this needle. And this is a process, folks. And again, the leadership of Tifa to really move this forward is just really impressive. And final slide, Karan, so that we have time for people. I want to thank everybody for listening. This slide, this PowerPoint slide deck will be available to you, as well as the link to that public report that we've made that have a lot more tangible suggestions for you in all the areas of your work. And Karan, we can open it up for questions.
Great. Thank you so much, Kathy. I will take over for Karan, who's done such a great job and helping to orchestrate this presentation, but really appreciate, Kathy, the great information that you shared, and particularly how you have been able to align the concepts of livable communities and healthy aging and the 60s framework. So really appreciate those alignments. And so the first, and Karan, why don't you take the slides down so we can kind of see everybody while we go through the questions. Kathy, one of the first questions I'm going to pose, which follows on to what you just said, is actually the last question that was posed, but can you discuss how several counties are merging the CHIP, which is Community Health Assessment, Community Health Improvement Plan, and the Age-Friendly Action Plan? So how are those assessments being merged?
Well, some communities are very prospectively, actively holding additional focus groups or additional surveying of older adult subsets and adding older adult unique needs. I know Sarasota County has done that. And I know Alachua County, where Gainesville is located, is actually looking at that. I was in correspondence with their health planner multiple times already today. And then you've got counties who are also looking at the work where it ties in with, unless it's specific to, for example, maternal nutrition or something. Many of the CHIPs are focused on adult issues, and to what extent are those issues aging issues? And so really just starting to wrap around and recognize that in the work. And so we have one of our favorites to share, Megan, and I believe Ryan Mims has presented here before with Walton County, was able to show this amazing overlap and talk about the social determinants. He's got food, the farmers markets in there and everything. I mean, really community-wide work.
Yeah, I agree. I think that Walton and Sarasota are great examples of looking at those the age-friendly communities survey and just taking some of those questions and including them in their community health assessments would be one easy way to do that as well. So I'm going to go back up to the top, and we have a really interesting variety of questions. So hopefully we'll get through them. So the first one is from Linda, who asks, how do we help older adults decide essentially what kinds of modifications they need in their homes? Like, is there something that can guide that process in having those conversations? And I know, and this may be a very personal, this may be for the aging sector and not public health, but public health may have a role here as well. But I wonder if you have any advice on that question.
There are, I can send you, Megan, to share a universal design checklist. To the person who asked that question, one of the problems is that, as AARP likes to call it, the Peter Pan phenomenon. People don't see themselves as aging. They don't realize that they needed a seat height counter until they had a stroke, that they needed that door wide enough to fit a wheelchair, and now it's costly renovation. So part of it is a lack of awareness. A lot of your role, again, is education, folks. But it's not just education to older adults, it's also to realtors, to builders, to policy that might encourage the building of universally designed homes so that people can remain in those homes longer. And I give another shout out to Sarasota County on this, because they have a sustainability director that is very involved. Sustainability, you think normally, green environment. Well, guess what? When people are staying in their homes longer, that's also good. And so there's a lot of intersection in all of this work. So to the person who asked that, I will share a universal design checklist. And AARP has a home, actually, let me do the home fit guide. That's more user-friendly for an older adult. And again, people don't realize until it's, they wish they had thought about it.
Right. Thank you, Kathy. And I think some of those materials can be, shared, pamphlets can be printed out, and they can be shared at senior centers and at, fairs and those kinds of things. So definitely something that public health can do for sure. Another question, I think you may have already addressed this, but, and this may be more of a comment, in a correlation with the concept of the 7 generations, doesn't healthy aging for an individual actually begin before the individual's in utero stage, with what I will call mother, parents, extended family life stage? So I think you kind of addressed that.
Yeah. I mean, the data is really growing on all of that. And health is mattering before the zygote forms, folks.
Right. And this is an interesting one. And this question, the answer we may not know yet because we haven't done a full analysis of the climate change legislation. That's what this is about. So what intersection is there between the new climate change legislation and advocacy for livable communities? Is there any shared language?
I think, I think there is in parks, for example, because shade and other, accessibility features are part of that, and shade and trees go hand in hand. One of the ones that I think of a lot is older adults. There's a group, RISE, Retirees in Service to the Environment. And so getting people who are out there, talking about, alternative forms of energy. And some of these are retired people who've been in the field, and just some are other people who, did something else for a living, but now they care about cleaning up their community, or they care about greenhouse gases. So I unfortunately, I can't give you, but I know that there's a growing interest in the intersection between those movements. So I'm looking to all of you to share that with us.
Right, exactly. That's what these trainings are often a great opportunity for sharing information. We learn a lot from the audience as well. And so the last question that I have from the chat is, are there any frameworks that look at ensuring that older adults who are non-English speaking or who have few others from their cultural linguistic background nearby have access to the benefits of livable communities, or access to community health workers who may be part of that picture?
One of the tenets of the age-friendly work is inclusiveness. And we say to everybody all the time, look, when you're doing your assessment, you're not knocking on every door in the community, but do what you can to get as much socio-demographic, geographic representation as you can, so that everybody's voice is heard, or that there's an opportunity for input. Provide that on-ramp. And again, that's where your outreach abilities are very important, because everybody is part of the community. And this is, again, very aligned with public health, that so all the things that you're doing to reach out, that's what you do in an age-friendly work as well.
Great, thank you, Kathy. So I missed one, missed one of the questions. There's two more now. So how applicable is the age-friendly communities process for rural and frontier areas? Are there rural communities that have become age-friendly recognized?
Listen, my comment to that is the most age-friendly communities, over 100, are in the state of Maine, the nation's most rural state. Yeah. So, and many of them are volunteer-led. In some cases, rural communities do face different challenges than suburban or urban communities.
I can't stand him, honestly. I find him to be very annoying.
Can we please mute?
But you work with your assets and what's available, and the volunteer leaders in the rural communities are really, there's a lot of benefits too, knowing people, knowing your neighbors, knowing previous generations. So there's a lot of strengths that are inherent in that as well. But yes, the unified model works everywhere. It may be implemented differently, but the model really works everywhere. And there's a lot for that person who wants to know. I can share with you a lot more on rural.
Yeah, that would be helpful. And just by the way, everyone, we'll be sending out Kathy's PowerPoint and any resources that have been shared during this presentation to everyone who registered. So please make sure that you have registered so that you can get the resources. So we'll definitely share those. I just saw another, somebody put it in several of Oregon's rural areas, engaging with partners to bring visibility and accountability to age-friendly opportunities is critical and key. But there was another part of that question on rural about walkability, and I'm sure that walkability has got to be a little bit more challenging in rural areas. But I mean, every community is unique, and that's the beauty of age-friendly public health systems and livable communities, is that you work to address and the unique challenges within each community, and the unique partnerships and collaborations within each community as well.
Exactly, Megan. It's so aligned with community health improvement practice So glad to see the marriage between age-friendly and public health. And again, the model is so helpful.
Yes. So one more interesting question for you, Kathy. So if you personally, if you had $1 million to research in another country, where would you like to go to see what that other country is doing?
Well, of course, I always want to go to Italy if I can, you know, but just because I want to go there and eat some Italian food, folks. But you know, probably I don't know. I think maybe the UK, because they have a Center for Aging Better. They appointed a minister of loneliness to address social isolation. So probably the UK, because of the incredible commitment at the highest levels of government. For all of you who have seen, you know, even at the end, those little icons that show really positive little icons like crossing the street, all that's from England. So, you know, I would want to go somewhere where I think they're really committed. And I'm not saying that we aren't. We may not be as together on it as we could be, but this movement is growing, and we're all part of it, and we're all in it. And it's a really beautiful, positive thing in a very tough time in our nation's history. So I'm glad to have something positive.
Yes, totally agree. We had one more question on transportation, which Kathy, I will share with you afterward, and perhaps we can provide some additional resources on transportation. Thank you so much. I'm going to turn it back to Karan for the last 2 minutes to close us out. Kathy, great job as usual. So happy to work with you on this.
Thank you so much, Dr. Kathy Black. I learn things anytime I hear you speak. Make sure I have sharing the right screen. Okay. Just to close this out, thank you all again for attending today. Just as a reminder, our trainings are available to register for on our website under AFPHS.org. There's a big block that says events. Our next training will be September 15th at 3 p.m. So stay tuned. We will announce it via our newsletter and posting on social media. So please join us for our next training. And for those of you that are viewing this training as a recording, please pause right now, copy or type down the link below to acknowledge your attendance at this session. For those of you that are not aware, we have a champion designation for individuals that attend 6 of our trainings. So please pause, log your training that you've attended here, and we will track your attendance. For those of you that are here live, thank you for attending, and have a great afternoon or late morning.
Thanks, everyone.